Hey, I'm Dr. Joe, and I am to LoveThatFace.com. And if you follow my channel, you know that one of the things that we do a lot of is treating benign osteomas. These are bony bumps, like little knuckles on the forehead that people get. And some people relate them to having trauma. Other people say that they just grew there and usually come here when they start getting bigger. There's not a lot of people that do this endoscopically. The old-fashioned way to do this is to make a big incision and pull the scalp down and do this, but I treat this endoscopically with little tiny buttonhole incisions behind the hairline. And it works out real well, and I've done people from all over the United States and people internationally, because there's just not a lot of people that do this endoscopically. So, got a great patient here today, and thank you for appearing.
Oh, of course.
And so let's talk a little bit about this. How long have you had your osteomas?
Well, at least 20 years, maybe even 25 years I've had them.
Did they just kind of grow and one day they were there, or do you remember?
Yeah, I just started noticing them when I would wear a hat or have to wear a helmet for, like, say, for example, I went whitewater rafting, horseback riding, that type of thing, and I noticed that I had a lot of pressure on my forehead, and the bumps started out small and they became larger and larger over time.
Take your headband off a second and let's see how you usually wear your hair. So you always wear bangs to cover them?
Oh, always. And I'm always careful when I have a picture taken that there's no wind, that the bangs don't blow to the side.
It's a good thing I don't have them. I'd be in big trouble. Now, you told me that sometimes this is a problem with other things. You want to talk a little bit about that?
Well, like I said, whitewater rafting, we went whitewater rafting, and the helmet had to be sort of tight so it didn't fall off when we hit a rapid or something. And by the time I finished the trip, my whole forehead was red and throbbing. And when we went horseback riding, I had to have the helmet way back on my head. We camp, and I can't wear those forehead flashlight
see, you never think about
bands
that,
because so it has to be like up here, and I have to put my head way down to be able to see the ground.
Well, it's very interesting because, everybody has their reasons, of course, why they don't like this, but almost, everybody, it's just because of the way they look and, having socially, they'll be talking to people and then everybody's staring at their forehead, that sort of thing. But that's interesting because a lot of people don't mention the functional situation. So this patient has two osteomas, a big one and a smaller satellite lesion there. And, most people have one, but I've done people that had 4 or 5, and these are almost always on the frontal bone. Now, a lot of people think they have osteomas, and they're really cysts or lipomas or some soft tissue, but these are little knuckles of bone, and they're immovable, so you can't wiggle them around. So what we'll do is we'll make 1 or 2 incisions back here in the hairline, and we'll separate that layer from the frontal bone, and we'll put a scope down there and visualize this, and then we'll put little instruments to shave it down and reduce it until it's flat. And the surgery takes about an hour. Patients come here, they usually stay overnight, and the recovery has been surprisingly easy. People maybe have a headache the next day, but they're usually so happy to have this gone that they just breeze through everything. And we really haven't had any problems or complications with them. And I have yet to have one grow back. I get asked that question a lot. So I really appreciate your allowing us to film this and talk about it, because it's very educational. People will see this and they'll understand a little bit more about it. And what we're going to do, we're going to follow her through the surgical process, the day of surgery, and we'll show how we do this in surgery, and then we'll talk to her after surgery. And since you're from out of town, maybe we can do a Zoom or something so you can tell people how it was when it's all said and done. All right? Thank you so much.
Come visit you again.
You're a VIP here. Okay, so here we are in the operating room. We're going to do this osteoma. I'm going to use the endoscope. We're going to make some buttonhole incisions in the hairline, and we're going to look at these osteomas and take them off, and the whole thing should take about a half hour. So we made our incision. We inserted the scope, And now we're going to show you what we see endoscopically on our monitor.
2, 1.
Okay, so here is our view of the osteomas. This is the one on the right side of her forehead, and this is the one that's more in the middle. So she has two very well formed bony osteomas, and we're going to remove this endoscopically with some instruments. We'll be back and show you. So we've just used an instrument to dislodge this osteoma, and now you're going to see that we're going to move it, and we're going to take it out of the incision, and we'll come back and show you in a second. Okay, so here's the osteoma. We've taken it off like a nice round pearl, and we've just showing you where it was, and we'll go back and we'll smooth the base down, and we'll take the other one off. And here's the second osteoma. We've separated it from its base, and we will bring that back out through the incision. And now you can see here where this was the second osteoma, this was the first. We're going to go in there and smooth that, but that's basically how we remove these benign bony growths. And this is a little device that will shave down any of the irregularities here, so we'll get a nice smooth surface, and we'll use this to go over the area where the osteomas were. And this is a very fine file, maybe like the file you'd use for your fingernails. It's a diamond file, and then this is the final process here where we're smoothing the bone. And we'll come back here in a second and show you where the osteomas were. And I'm proud to say here is where the osteomas formerly lived. And you can see that it's nice and smooth now, smooth frontal bone. And this is something that really bothered this patient, and it's really a great feeling that we're able to smooth these down and do it with one tiny hidden incision in the hairline. So here are the osteomas. We've sewn up our single, just one incision right there. And that's the bigger one, that's the smaller one, that's where they were. And they're not gonna bother her anymore. This is really an enjoyable surgery for me, and we do this on patients from all over the country.
1.
So here we are with, here's your osteomas, right? Nice little present for you. So how do you feel?
I feel great.
Okay, so she's been in here about 15 minutes, and it took about a half hour to do the entire procedure, and I think it's going to be great. I'm really happy, and you're not going to have those bumps on your head anymore.
I can wear a helmet. I could go whitewater rafting, horseback riding.
Only if you were
Wear
doing that before.
Wear my cowgirl hat.
That's it. You can do all that.
Yeah,
all right. So we'll talk to her when
excited.
she's completely recovered
Thank you so
and
much,
show you
Dr.
the area.
Lamb,
Thank you. It's my honor. Okay, so here we are, 24 hours after surgery, removing both of these osteomas. And you told me that story about your primary care. Let's just very briefly mention that.
Well, just 10 years ago, I mentioned to her that I was self-conscious about the osteomas and I'd want them removed. And she said, oh, that would be the worst surgery ever. You'd never want to go through that. Just wear your bangs and you'll be fine. And it was the easiest surgery that I'd ever gone through, and I should have done it 10 years ago, but I'm just so excited to have done it now. And Dr. Namtu was wonderful, and the pain was pretty much nothing. I took one Tylenol after the surgery and one Tylenol at bedtime just because, and I probably wouldn't have even needed that. So it was extremely easy, and I'm just so excited.
Great, great. Talk
So.
more about Dr. Nam. No, I'm just kidding.
Dr. Namtu's wonderful.
No, I'm just kidding. So she had these two big osteomas, and it just looks beautiful, okay? These little marks here from the injections of the local anesthetic, and of course we drew a circle around there, which will be gone. But she has a nice smooth forehead, and this is what it's all about, and it's going to be very successful. And this is why osteoma removal is one of my favorite surgeries. We'll look at her again probably in upcoming week. And here we are 4 weeks after removing two big osteomas that have been there for many, many years and were causing a lot of different problems, as you saw in the previous videos. And at 1 month here, she is really nice and smooth. I tell you, you want every operation to go perfect, and usually they do, or they're very good, but this is absolutely perfect. I mean, she has tiny, tiny bit of residual swelling here, but her forehead is smooth. We did it through one hidden incision back here, and her hair covers that. So it's just, from a surgeon standpoint, it's perfect. So tell us a little bit about the last month here.
Oh, it's been amazing. I mean, I took one Tylenol after the procedure and one that night, but just because I thought I should. I didn't even have any pain.
Okay.
It was actually enjoyable. I mean, your staff, the anesthesiologist, your nurses, it was an enjoyable experience.
Well, I'm glad you had a
So-
good experience. And so what's it like not having 2 knots on your head?
Oh, it's amazing. I actually went to the eye doctor.
camera.
I went to the eye doctor the other week, and where you have to put your forehead against the bar to see. I actually could put my forehead against there, and they were like, a little closer, a little closer. I'm like, and it didn't hurt. And I mean, I don't have to worry about the wind blowing, and I actually I'm like, wow, I
You don't
don't
have
feel
to
those
conceal
anymore.
it with your hair. in
And I'm
other
going to
words.
actually sport a new hairstyle where I grow out my bangs, and I'm so excited. I mean, you wouldn't think something like that would make such a difference, but it really did for me. I feel sort of normal again.
Well,
So-
that's great. And that's certainly, it's funny because sometimes we'll do procedures where we do a big face, deep plane face and neck lift with a brow lift, upper lids, lower lids, cheek implants, chin implants, full face laser, big, big, big surgery. And, the patients are happy. And then sometimes you do a relatively small procedure like this and they are elated. So I think that it worked just the way we wanted to. You were a great patient. You took good care of it and did everything you were supposed to do. And I think maybe I'll let my bangs grow out too. Huh? All right. Listen, thanks for being
Oh,
such a
thank
great
you.
patient. And so this was a removal of 2 osteomas. And you're going to see the footage of the actual footage. So if you're squeamish and you don't want to see this, but we just had one little buttonhole incision up here and did the whole thing endoscopically.
So if you're worried about it or wondering, don't even think twice. It was a piece of cake.
And if you have any questions about forehead osteomas or any cosmetic facial surgery, I'm Dr. Joe Niam to lovethatface.com.